Hello everyone, and welcome back to the Medical News Roundup. It's December 6th, 2025, and we're diving into the medical headlines making an impact today. From global health initiatives to local clinical breakthroughs, here's what you need to know. First up, a major global health update. The World Bank and the World Health Organization report that most countries are making progress toward universal health coverage, a key 2030 goal. However, significant challenges remain in ensuring equitable access, especially for vulnerable populations like those in poverty or rural areas. New national health compacts have been introduced by 15 countries to expand primary care, improve affordability, and strengthen the health workforce. On the research front, a fascinating study reveals that where you live might affect your weight more than lifestyle choices alone. The study, published in Social Science and Medicine, highlights the profound influence of our environment on body weight. We also have some exciting news in precision medicine. Care hospitals in Visakhapatnam, India, announced they have completed over 1,000 robotic gastrointestinal surgeries, marking a new era of advanced, minimally invasive procedures in the region. In other news, a philanthropic foundation in Maharashtra, India, set a Guinness World Record for the most knee screenings in 24 hours, committing funds to expand rural joint care. India and Russia have signed a health cooperation agreement aimed at boosting joint research and medical education. And closer to home, the government is expanding AI programs across India's public healthcare system to enhance diagnostics and efficiency. IIT Bombay finds how tuberculosis bacteria resist treatment. Tuberculosis bacteria survive treatment by altering their outer skin. Researchers at IIT Bombay found that dormant bacteria build a rigid lipid shield that blocks antibiotics. By identifying this mechanism, scientists are developing new therapies that weaken this armor, making existing drugs effective again. This discovery could help shorten difficult treatment times for millions worldwide. Key takeaways. In a French cohort, the incidence of all-cause mortality among those who received a first dose of an mRNA COVID vaccine was 0.4% after a median follow-up of 45 months, compared with 0.6% of those who were unvaccinated. After standardizing characteristics between the two groups, all-cause mortality incidence was 25% lower in those who had received a COVID shot. Vaccinated people were 74% less likely to die in a hospital because of COVID-19 compared with those who weren't vaccinated. MedPage Today. Free births? Capitalizing on medical distrust, some influencers are selling guides to free births, medically unassisted births, and wild pregnancies without prenatal care. The Guardian recently published an investigation into one such group, the Free Birth Society, an influencer-led business that promotes pregnancy and birth without medical care, meaning no nurses, midwives, doctors, or any other medical support. The group is even anti-ultrasound. You are powerful, birth like it, the group's website says. Memberships and courses to be part of the community run hundreds of dollars. While Free Birth Society leaders raked in millions and grew their platforms, moms across the globe lost their babies and suffered often preventable and treatable complications, the investigation found. OB/GYNS told MedPage Today that groups like Free Birth Society prey on patients who want the best for their baby but have concerns about the medical establishment. MedPage Today. Methotrexate, a drug born from mistakes that changed medicine forever *. When you hear methotrexate, MTX, you probably think of Farber or Gubner. But the story actually begins in 1945 with Subburo, an Indian-American scientist most people have never heard of. But few know about the brilliant scientist who paved the way for its success, Dr. Yellapragda Subbaro. Let's uncover his story. Born in rural India, 1895, Dr. Subbaro's life was full of struggles. He studied at Madras Medical College, but due to his ties with the Indian independence movement, he was denied a full MBBS degree. Instead, he received a lesser licentiate of medicine and surgery. With limited career options, he became a lecturer at Madras Ayurvedic College and eventually its vice principal. But fate had other plans. An American doctor, John Fox Kendrick, saw his potential and inspired him to pursue further studies at Harvard. Overcoming enormous financial struggles, Subbarao made it to Harvard School of Tropical Medicine. But there was another roadblock his lesser licentiate degree meant. Crossmark no scholarships. Crossmark no internships. So he worked part-time to survive. At Harvard Medical School, alongside Dr. Cyrus Fisk, he made groundbreaking discoveries. Small blue diamond, the Fisk, Subbarao method, 4-phosphorus estimation, still widely used. Small blue diamond phosphocreatine and ATP discovery, yes, the energy molecule. Yet, he was denied a faculty position. Frustrated but determined, he left Harvard in 1940 and joined Letterly Laboratories as director of research. Here, his genius flourished. White heavy checkmark folic acid and vitamin B12 synthesis. White heavy checkmark tetracycline antibiotics discovery, leading to doxycycline. White heavy checkmark diethylcarbamazine, used globally to fight filariasis. / the cancer breakthrough that led to MTX. In the 1940s, cancer researchers sought a way to stop tumor growth. At Mount Sinai Hospital, a folic acid antagonist was found to inhibit tumors in mice. Farber's mistake that changed medicine. Farber tested folic acid on leukemia patients, hoping to help. But instead of stopping cancer, it made tumors grow faster. He realized, if folic acid fuels tumors, blocking it might stop them. Farber turns to Subbarao for help. Subbarao and his team synthesized a powerful antifolate drug, aminopterin. For the first time, childhood leukemia was treated successfully. But aminopterin was toxic and unstable, so they worked on a safer version. The breakthrough? Subbarao suggested adding a methyl group to reduce toxicity. This led to amethopterin, which was later renamed methotrexate. Why is it called methotrexate? Farber was worried about toxicity, so he added met for metabolism. X because, at the time, poison bottles had an X on them. From cancer drug to rheumatology's gold standard. In the 1950s, researchers noticed MTX not only stopped cancer cells, but also suppressed inflammation. Dr. Gubner and Olson, who worked with Subbarao, tested it in RA and psoriasis, and it worked. But doctors were skeptical. Why use a toxic cancer drug for a non-lethal disease? It wasn't until 1967 to 1980 that low-dose MTX, less than or equal to 30 milligrams per week, gained acceptance. Later randomized trials proved MTX's safety and efficacy. MTX today, a life-saving drug. White heavy checkmark gold standard for RA, JA, psoriasis, myositis, SSC. White heavy checkmark FDA approved for RA. White heavy checkmark, still one of the most widely used MARDs in the world. But what about Dr. Subbarao? A forgotten legacy. Despite revolutionizing medicine, Subbarao never received the recognition he deserved. His colleague, Nobel laureate George Hitchings, later admitted some of his discoveries had to be rediscovered later because his work was hidden out of jealousy. The harsh reality. Never got U.S. permanent residency. Denied a faculty position despite groundbreaking research. Rarely mentioned in medical history. Yet, his work saved millions of lives. Honoring a true pioneer. A memorial plaque and library at Letterly Labs. A bust in Nizam Institute of Medical Sciences, Hyderabad. A commemorative Indian stamp in his honor. But his name remains unknown to most doctors today. As we celebrate medical advancements, we must remember pioneers like Subbarao. His brilliance gave us MTX, ADP, folic acid therapy, antibiotics, and more. A legacy of science, perseverance, and a passion to heal. That's your medical news update for today. Stay informed, stay healthy. Please make sure to subscribe my channel for more health headlines. We'll see you next time. Disclaimer: use the content after verification.